Let's talk about labor and delivery for a minute. For 9 months, the unborn child has been developing in the womb. Now the baby's ready to make an exit. Pre-labor is a period of irregular uterine contractions in which the cervix thins, softens, and may begin to dilate. Labor is commonly divided into 3 stages, wherein the baby is expelled from the uterus through the birth canal and into the world. It begins with irregular contractions of the uterus that occur every 20 to 30 minutes. As labor progresses, the contractions increase in frequency and severity. For women giving birth for the first time, labor will usually last between 12 to 24 hours. However, for women who have given birth before, labor usually averages about 6 hours. Let's look at the stages of labor. In the first stage of labor, the uterine contractions begin, and they're usually about 10 to 20 minutes apart. Initially, they're gentle, but they tend to become more powerful and sometimes uncomfortable. The cervix dilates with each contraction, and the baby's head rotates to fit through the mother's pelvis. You can see on the left is the very beginning of the first stage of labor, where the cervix is thinning, which is called effacement, and it's dilating. By the picture on the right, you can see that the opening right there in the cervix is bigger, and the baby's head is turning so that it can fit through the cervix. The second stage of labor is when the cervix fully dilates. A fully dilated cervix is 10 centimeters. It usually lasts about 90 minutes, and once the cervix is open, the baby begins to move down the birth canal. The mother pushes or bears down in response to pressure against her pelvic muscles, and the crown of the baby's head becomes visible in the widened birth canal. You can see that the crown of the baby's head is kind of poking out there. That is called crowning. And when the doctor or the nurse sees the crowning, then they know that it is time for the baby to come. Birth is what happens at the very end of the second stage of labor. You can see the baby's head comes out, and then the doctor will turn the baby's shoulders, like you can see on the right, and the shoulders will come one at a time, and then the rest of the body just slips right out. After the baby is out, the umbilical cord is clamped off and cut. The third stage of labor is the not fun part. You've got the baby, but the placenta and umbilical cord are still in there. So the third stage of labor is when the afterbirth or the placenta comes out, and it usually happens within about 10 minutes. Let's back up for just a second. I just want to talk about this birth stage again. As the baby is coming out, coming through the birth canal, sometimes the opening is not quite wide enough, and the doctor will perform a little incision called an episiotomy that just allows the baby to come through more easily without tearing the mother, which can be quite painful. All right, let's move on here to the breech position. The breech position is when the feet or bum are down. That's not a good thing. That's usually causes complications during birth to the mother, to the baby. So a lot of times when babies are in the breech position, the doctor will just do a C-section. And this is what a C-section looks like. They make a cut in the mother's abdomen, lower abdomen, and they bring the baby out through that incision, and then they pull out the placenta and umbilical cord, the afterbirth, and then they just stitch it up. Recovery from C-sections is a lot longer than natural or not natural vaginal births, but sometimes C-sections are necessary. I just wanted to give you a few cases when C-sections are necessary. we just talked about if the baby's in the breech position, if the mother is too small or the baby is too big to fit through the birth canal, if the baby's in distress, if its heart rate is going down, they will do a C-section. If the baby's cord is trapped, the umbilical cord is trapped by the head or shoulders, or if it's wrapped around the baby's neck, sometimes they'll do a C-section. Or if there are other health conditions like STDs that they don't want to pass on to the child. If the mother has had a previous C-section, there's a good chance that she will have to have a C-section for the rest of her births. An epidural is given to mothers who give birth vaginally. It deadens from the waist down so that she can't feel all of that pain. I've had epidurals with 3 of my 4, not by choice. My third one was quick. She was here within 45 minutes and they didn't have time to give me an epidural. But I would have to say that I definitely prefer the epidural, but that is totally my opinion, and some women really prefer not to have it. And the last thing I want to talk about quick is the APGAR score. Right after a baby is born, immediately after, the nurses will perform some tests just to make sure that the baby is healthy. The APGAR score is, you can see down in that left column, activity, pulse, grimace, appearance, and respiration. If they're doing all those things well, they get a high score. If they're not doing them well, they get a low score. So they will do this test immediately and then wait 5 minutes and do it again 5 minutes later. And usually the first score is a little bit lower. The second score, though, should be up between 7 to 10, and if not, that's when they call in the NICU, neonatal intensive care unit, to help get the baby breathing or moving or get the pulse up, whatever it is that the baby is lacking. So that is labor and delivery.